Recent advancements in technology have introduced exciting possibilities for early diagnosis of neurological diseases like multiple sclerosis, MS, and Alzheimer's. One of the most promising innovations is the use of virtual reality, VR, headsets, which could revolutionize how these conditions are detected long before the onset of significant symptoms. Neurologists and researchers are increasingly optimistic about the potential of VR to not only detect these diseases earlier, but also improve the overall diagnostic process. By leveraging VR technology, doctors can provide more accurate and efficient assessments, ultimately leading to faster interventions that could significantly improve patient outcomes. The concept behind using VR for early diagnosis is based on its ability to immerse patients in simulated environments that test cognitive functions, motor skills, and other neurological responses in real time. Unlike traditional diagnostic methods, which can sometimes rely on subjective reporting of symptoms or delayed imaging results, VR offers a dynamic and interactive way to assess a person's brain function. This immersive experience can reveal subtle signs of cognitive decline or motor dysfunction that may not yet be evident through standard tests. With VR, healthcare providers can gain insights into how the brain is functioning under various simulated conditions, making it easier to detect early warning signs of both MS and Alzheimer's. What's particularly exciting about this breakthrough is the potential for earlier and more accurate diagnoses. MS and Alzheimer's are notoriously difficult to diagnose in their early stages, often requiring a combination of tests and a long period of observation before a clear picture emerges. By incorporating VR technology, doctors can access data and patterns that might otherwise go unnoticed, leading to a quicker and more definitive diagnosis. Early detection is crucial in both MS and Alzheimer's, as starting treatment sooner can slow the progression of these diseases, improving quality of life and giving patients more time to manage symptoms effectively. In the case of Alzheimer's, for example, early diagnosis may allow for interventions that can delay or prevent the onset of severe cognitive decline. Moreover, VR technology is non-invasive and can be done remotely, making it a more accessible and convenient diagnostic tool. This is particularly important in the context of MS and Alzheimer's, where patients may face mobility challenges or have difficulty traveling to medical appointments. VR allows patients to engage in diagnostic tests from the comfort of their own homes, which could increase the likelihood of regular screenings and earlier detection for a wider range of individuals. This convenience also reduces the strain on healthcare systems, as VR assessments can be done more efficiently, freeing up resources for more complex cases that require in-person care. The use of VR for diagnosis also has the potential to enhance patient engagement and understanding. Traditional diagnostic methods can sometimes feel intimidating or confusing to patients, especially when it comes to conditions as serious as MS or Alzheimer's. VR, on the other hand, is an interactive and user-friendly technology that may help patients feel more comfortable and informed throughout the diagnostic process. By engaging patients in a virtual environment, they can directly see how their brain is performing, providing them with a sense of control and involvement in their healthcare journey. Another exciting aspect of VR technology in early diagnosis is its ability to improve longitudinal tracking of neurological diseases. With repeated VR assessments, doctors can closely monitor changes in a patient's condition over time. This ongoing monitoring could help detect subtle changes before they become clinically significant, allowing for timely adjustments in treatment and care plans. Additionally, VR could be used to track the effectiveness of interventions and therapies, offering a more objective measure of progress compared to traditional methods. This kind of continuous assessment could make a significant difference in how MS and Alzheimer's are managed, ensuring that patients receive the best possible care at every stage of their condition. The implications of this technology go beyond just MS and Alzheimer's. If VR proves to be effective in diagnosing neurological diseases early, it could pave the way for similar approaches to other conditions, such as Parkinson's disease, stroke, or even certain forms of brain injury. The ability to detect a range of neurological conditions with VR could lead to a broader transformation in the field of neurology, allowing for more widespread and proactive care, that can reduce the long-term burden of these diseases. In conclusion, the use of VR technology to diagnose MS and Alzheimer's represents a promising leap forward in the early detection and management of neurological diseases. This approach offers the potential for faster, more accurate diagnoses, better patient engagement, and more effective long-term management of these conditions. By making diagnosis more accessible and interactive, VR could significantly improve patient outcomes, giving people living with MS, Alzheimer's, and similar diseases the best possible chance for a healthier, more independent future. With continued development and integration of VR in healthcare, we are on the cusp of a major breakthrough that could change the way we approach neurological health for years to come.